How will practicing medicine change long term due to what we've learned or been affected by during the COVID pandemic?
Well, I strongly believe that the impact of this pandemic on the way we practice will modify how we practice. In our clinical lives, we get educated, trained, and go into practice. And the way that we go into practice is greatly impacted initially on how the physicians who taught us practice. When I was a resident, I learned from every clinical rotation things that I wanted to emulate and things that I swore I would never do in my practice. That's part of clinical education. And when I went into practice, I continually learned from every patient I cared for on a daily basis. So when this pandemic is over, we will take new lessons learned on the way we practice, and we have to modify how we will practice in the future. Now, osteopathic medicine is centered on the idea of a whole person approach to care, that the body is a unit and the person is a unit of body, mind, and spirit. The rational treatment, we believe, is based on an understanding of basic principles of body, unity, self-regulation, and interrelationship of structure and function. This means we look at the whole person. Also, the health of the community and how social determinants will factor in. And it is my great hope that this crisis will change our approach to the way we practice medicine so that we can move towards a focus on prevention and wellness rather than acute traumatic care.